Siamo a Roma nell'occasione di un importante incontro che ha fatto il punto sulla cura delle malattie dell'occhio nei paesi in via di sviluppo. Questo incontro è stato realizzato con il contributo di AMOA, l'Associazione dei Medici Oculisti per l'Africa, ed è stato realizzato grazie al supporto di MSD. Parliamo di glaucoma, una delle patologie che è stata trattata qui in occasione di questo convegno, con la dottoressa Papadopoulos, che lavora in Gran Bretagna e che è uno dei massimi esperti internazionali nella cura del glaucoma, specialmente per i bambini. Dottoressa Papadopoulos, come si presenta il glaucoma nei pazienti africani? Ci sono delle specificità? Which is the look of glaucoma in an African patient? There are some specificity in comparison to the Western people.
We find that Africans tend to have much higher pressures when they present, much higher intraocular pressure, and therefore worse disease. And when they present in Africa, often they're already blind in one eye, and much younger adults present with very severe glaucoma.
Come si tratta il glaucoma appunto nei paesi africani? Quali sono i problemi nella decisione di quale trattamento adottare? How do you treat glaucoma and which are the problems that you have to match when you choose from medical treatment and surgery treatment?
Yes. The typical treatment is, say in the developed world, we give drops first, we may consider laser before we do an operation, but the problems in Africa are the medications may not be available, they may be too expensive to afford for the patients, or they sometimes need to be refrigerated and they may not have, refrigeration. So the next option is laser, tends to be very expensive, cannot be afforded, and also these machines, if they break down, they're often broken down forever. So the best option seems to be surgery in these patients, but even with surgery there are problems. This is an incurable disease. The operations we do rely on some degree of healing, but not complete healing. And Africans tend to heal very aggressively, so they need very intensive follow-up and they need intensive drops. Those two issues are a problem. In terms of follow-up, these patients often live hours away in a village to the main, eye facilities, and they may not be able to afford the medication that they need sometimes for months, 2 to 3 months or longer.
Which is the type of surgery you prefer to use in these cases? Quale chirurgia viene adottata in questi pazienti?
I think the best operation, it's not the ideal operation, but the best we have available for, actually worldwide, is an operation called trabeculectomy, where we create an alternative pathway for the fluid to flow out of the eye and in that way reduce the intraocular pressure.
Ecco, qual è il tasso di successo con questa operazione? Which is the rate of success with this type of approach?
The rate of success tends to be very good at the beginning, say after a year or two, but it's not a cure. So eventually these patients need to go back on drops. The available literature from African countries on trabeculectomy often is troubled because the follow-up usually tends to be very short, and we don't know, a lot of these patients we don't see again after we operate, so we really don't know what the outcome really is in the patients, but it's the best operation we have for them.
Qual è il futuro nella cura del glaucoma nei paesi africani? Which is the future of glaucoma treatment in African?
That's a very, very good question. I think that's yet to be answered. At the moment, I think we know that trabeculectomy seems to be the best operation. Is it the perfect operation? The answer is no. The other alternative is to put a little tube in the eye, but at the moment, that is far too expensive for for Africa to afford. But if it becomes available much cheaper, say being produced in India, which is currently underway, that may be an alternative, a better alternative, but we need studies to prove that in the African people.
Lei è ottimista? Are you optimistic?
Yes, I'm always optimistic. I did glaucoma, I have to be optimistic. Yes.